When Serena Williams gave birth to her daughter Olympia by emergency C-section on September 1st, 2017, she described holding her in her arms for the first time as an amazing feeling. The very next day, though, she felt short of breath and told the nurse that she needed a CT scan and blood thinners because she had a history of blood clots. The nurse brushed her off, suggesting that her pain medication was making her confused. Serena Williams, arguably the greatest athlete ever, who pushed through multiple injuries over the years to win 23 Grand Slam titles, who knows the difference between normal discomfort and dangerous pain, had to demand the test more than once before the team listened. The CT scan revealed several clots in her lungs, and without treatment, she might have died. Think about that for a moment. If this can happen to Serena Williams, whose wealth and fame give her the privilege of the best health care, with a documented medical history of blood clots, speaking clearly and specifically about her symptoms, what does that mean for the average woman without her resources, her understanding of her diagnosis, or her confidence to speak up about her own care? Now, this is not an unusual story. I hear it from my clients, from executive women managing multi-million-dollar portfolios, but they can't get their brain fog taken seriously. Mothers with exhaustion told it's just stress. From teens with cramps told to toughen up. What I'm talking about here has a name: medical gaslighting. Medical gaslighting has been called the #1 patient safety concern for 2025 by ECRI, a leading healthcare safety institute. And as a physician, I need to tell you something that might shock you. We, the providers, are the problem. In my early years of surgical residency, I was guilty. I dismissed women's pain. I chalked it up to them being soft or dramatic. I was trained to think that way. Many of us were. And then I had an emergency C-section. After hours of trying to deliver vaginally, I was rushed into surgery, and suddenly I was on the other end of that scalpel, experiencing the type of surgical pain I had previously just brushed off in my patients. Now, that surgery left me with more than a beautiful baby boy and a lifelong scar. It rewired how I practiced. I learned to listen to my patients deeply and intentionally. Because the problem when we don't listen is then we have to rely on population averages instead of the person sitting right in front of us. When we assume instead of investigate. And not even doctors are immune to being gaslit by the very system we were trained to trust. 12 years ago, I found myself in a hospital bed again with my third blood clot in just over a year. The first two, pulmonary emboli, just like Serena. One night, my husband had come in to see me. I was sitting up in bed with a silly grin on my face, speaking gibberish with a fever of 102. I was septic, a full body infection from an infected Lyme. My white blood cell count, a normal 7, but my baseline was 3. I was in trouble. Yet when my husband called the doctor that night, she dismissed him. Her labs are fine. She's probably just tired. He insisted on antibiotics, and that insistence saved my life. Now, I'm not famous, and I can barely hit a tennis ball over the net, but that moment reinforced me something that textbooks never could. When we rely on what's normal, when we minimize or ignore what a woman is speaking, we risk her life. We literally risk her life. And I'm not trying to call out individual bad actors. The system is biased in how we train doctors, design research, and write clinical guidelines. It's a flawed system that was built by men, for men, and continues to fail women every single day. Did you know that until 1993, most clinical trials excluded women altogether? Important standards like drug dosing and heart attack symptoms were all based on the then average 154-pound white male. That means that for decades, our healthcare system was literally one size fits men medicine. So what has this meant for women? Women are 50% more likely to be misdiagnosed during a cardiac event because our symptoms don't fit the typical male presentation of crushing left-sided chest pain. Being misdiagnosed carries a 70% higher death rate. 80% of autoimmune conditions affect women. Yet many of us spend years being told our symptoms are due to anxiety or depression and treated with antidepressants instead of receiving support for our immune system. Endometriosis affects 1 in 10 women globally. It takes 5 to 12 years on average for a diagnosis. The economic burden in the US alone, $78 billion. And that is more than the annual GDPs of Iceland and Jamaica combined. And if you're a woman of color, LGBTQ, differently abled, neurodivergent, the risk of being dismissed skyrockets. Now, we've talked about what happens when the woman sitting in front of a healthcare provider isn't heard. Now let's see how this came to be so deeply rooted in our history. Because it goes back centuries, all the way to ancient Greece, when Hippocrates claimed that a woman's uterus could wander around her body, causing illness, seizures, and mood swings. He called it hysteria, from hystera, the Greek word for womb. Centuries later, it became the catch-all diagnosis for any woman considered too anxious, too emotional, too vocal. Freud and others gave it a psychological label, but it always had the same undertone. You're not really sick, it's all in your head. Now, while this was harmful in the field of psychology, it took an even darker turn in the field of women's health. In the mid-1800s, Dr. J. Marion Sims came to be celebrated as the father of modern gynecology. He earned that controversial title by performing as many as 30 experimental operations experimentally on black women slaves without anesthesia. Sims believed that black women didn't feel pain the way that white women did. It wasn't until 1980 that the diagnosis of hysteria was finally removed from medical code books. And a modern gynecologist would never consider performing a major operation without anesthesia. But let's be honest, the shadow of ignoring women and their pain still lingers. Take IUD insertion. Women describe that pain as 6 to 7 out of 10. That's root canal territory. Yet in 2025, despite new recommendations from the American College of Gynecology, 95% of women receive no pain relief other than ibuprofen. So if you've ever felt unseen or unheard by a healthcare provider or system, it's not in your head, it's in our history. Now that we have the diagnosis of medical gaslighting, I'd like to introduce a cure for this long-standing condition, evidence-based bias reduction, or in simpler terms, we listen, you speak. Listen. Listen without interruption. Ask open-ended questions to generate conversation. Investigate gender-specific presentations. Don't assume the averages. Standardize care using protocols that reduce subjective bias. Train your team in bias interruption tools. Implicit bias isn't a moral failure. but it is a clinical one. Evaluate outcomes. Evaluate outcomes by gender, race, and identity, and navigate care using teams that focus on the patient, not just the presumed diagnosis. This isn't just theory. At Johns Hopkins, women were found to be 50% more likely than men to be denied a life-saving blood clot prevention. A simple mandatory checklist eliminated that disparity completely. And for patients, we teach speak. Speak up using clear, firm language. Ask, for example, will you explain why you're denying this test? Prepare by logging symptoms. Educate yourself. Know your family history. Know your normal lab values. Advocate for second opinions and appropriate referrals. And finally, keep records. Every appointment, every lab, every denial. One woman I worked with had been denied for 7 years before she used Speak. And within 3 months, she had a diagnosis and the appropriate treatment. So I'd like to leave you with a challenge. In the next 30 days, take one step. If you're a provider, listen. Be the doctor you'd want for your mother, your daughter, your partner. If you're a patient, speak. You are the expert on your own body. If you're a healthcare policymaker or leader, change the system. Design protocols that include all bodies, not just the default male ones. And finally, if you're human, use your voice as an advocate for those you love. Because the woman sitting next to you, the woman you love, the woman looking back at you in the mirror, she deserves to be heard, believed, and healed. And for every woman sitting here in the audience, I want you to know that I hear you, I see you, and I promise you that I will do everything I can so that in the future, we listen. Thank you.